Hello everybody. So today we're going to be going over blood pressure, how to take blood pressure step by step, interpreting your results, so on and so forth. So first you want to make sure that your participant has been seated for about 5 minutes, not exerting themselves. You also want to make sure before you start that their feet are uncrossed, that their feet are flat on the floor, that their back is supported, and that you raise their arm up to about chest height for the best reading possible. You also want to make sure they haven't been smoking or drinking caffeinated beverages, as this can affect your results. Now to begin, Eddie here has a relatively regular sized arm, so for him we're going to be using a regular sized cuff, not a smaller or larger one. You want to make sure that you roll up the participant's sleeve so that the sleeve isn't in the way of the cuff and messing with your results. Now when you fit the cuff on the individual, you want to make sure that the artery mark is on the medial side of the arm or on the inside of the arm. There you can see the small white arrow, which is the artery mark. When you place the cuff on, you want to make sure that it's snug, not too tight but not too loose. You also want to be able to make sure that the participant can flex their elbow. If they can't, then the cuff is too low. In this case, we actually have to attach the dial to the cuff itself for our readings. When you use the stethoscope to listen for the Korsakoff sounds, you want to make sure that your prongs are facing forward in your ears. You want to make sure when you hold the diaphragm, you're holding it from the sides, as you'll be able to see here in a minute. You also want to make sure that it isn't actually under the cuff itself. So you want to let all the air out of the pump and then slowly begin pumping air into the cuff. If you can see, you want to inflate the cuff to around 180 to 200 millimeters of mercury and slowly begin to release the air. Now the small beating sounds you're listening for are the Korsakoff sounds. The first sound you hear will be your systolic pressure, and as soon as the sound begins to fade out, that will be your diastolic pressure. The systolic is the numerator, the diastolic is the denominator of the value. Once the sounds are done, you want to release all the air from the cuff and remove the cuff from the individual. Now coming up, you should be able to see how the ACSM has set out the values for normal, pre-hypertension, and hypertension. And thank you so much for watching. I hope you enjoyed.